Yes, this is Dr. Clark from the Center for Weight Loss Success, and I have my contact information there up on the screen. We're located here in Newport News, Virginia, and the phone number there, 873-1880. If you want extra information, I'd encourage you to go to our corporate website, which is cfwls.com, Center for Weight Loss Success, the initials, and get lots of information there. And every week I do a free webinar or a free seminar going over all the surgical options of weight loss. This is going to be a somewhat abbreviated version of that, but we are going to cover the high points, so to speak, but I do go into more detail. It's actually about an hour and 15 minutes, and I'll do that one. But we're going to go ahead and dive in here about the surgical options of weight loss. Now, just to give a little background on myself too, is why can I talk about this? As well, I am a board certified surgeon, but I'm also board certified in bariatric medicine, which is two completely separate different specialties: medical weight loss versus surgical weight loss. And this surgery is something, weight loss surgery is something I've been doing for the last 21 years. I've done over 4,200 different weight loss procedures during that time frame. So this something is near and dear to my heart and very passionate about weight loss in general, just overall health. So anyway, if you want more information, please let us know. We're going to dive in, but 10 of you will receive this book here that I got listed up there, Less Weight, More Life. It's part of a series of books that I've authored, is Weight Loss Surgery Right for You. This one specifically looks at surgery itself. All right, now lots of different medical problems go along with weight, and what I've listed on this slide then are some really common medical problems. You probably recognize most of them. You may have a few of them. As weight goes up, these problems all get worse. We throw out the really common ones: the diabetes, high blood pressure, sleep apnea, heart problems. But the other side is as weight comes down, these problems tend to get better. Some of them completely go away with weight loss. Other ones at least get easier to control. If I could boil it down to the single most important medical issue associated just with weight in general, it's that as weight goes up, someone's risk of dying goes up, to the point that once you're between like 80 to 100 pounds or more overweight, the risk of dying actually goes way up. And on average, people that are 80 to 100 pounds overweight die a good 5 to 10 years before someone who's not. And when you boil it down, that's what we're talking about. We want you to live a long, healthy life, die of old age. And so how do you do that? Well, controlling your weight's a good step. And so there are lots of different options out there. I just kind of thrown up, what are the weight loss options? Well, you can divide them into broad categories: medical weight loss versus surgery, and it can be medical weight loss with or without medications. But all of these are really just tools. A medical weight loss plan basically is being on a good diet nutrition plan, activity exercise plan, and the broad category of what I'll call behavior modification. You put those three things together, you've got a medical weight loss plan. Throw on top of that medications or not, and they could be over-the-counter medications. There are a lot of them out there, as well as a few prescription medications that could help with weight loss. They're all just tools to help you. Surgery is just a much more powerful tool. That's all it is, but nothing magic. It's not that surgery, if someone has weight loss surgery, the weight magically falls off. It's still diet and exercise that gets someone to lose weight. The surgery gives you a tool so that diet and exercise works better, but that's all it is. And just like any tool, it can be used correctly or incorrectly. Used correctly, extremely powerful. Used incorrectly, well, potentially doesn't work very well for you, and people could get into problems with it. But all of these options should be thought of as complementary, not competitive. Typically, many places that you go for weight loss, you're either doing surgery or medical weight loss, and the two don't mix, which actually makes no sense, because we can use all the tricks from the medical side with the surgical side. So the two things, the medical and surgical side, actually mesh very nicely together and should be thought of as complementary to each other. Now, who's a candidate then to have weight loss surgery? Okay, I'm going to throw out some terms here that may not necessarily make a whole lot of sense, but I'll explain them. Anyone that has a body mass index over 40. all by itself. So what does that mean? Body mass index just takes your height into consideration. It's a mathematical equation. We plug your height and your weight into a mathematical equation. It spits a number out for us. It's the way to stratify health risk. So insurance companies use this to look at health risk. Okay, anyone who has a body mass index of 40, body mass index of 40 is around 100 pounds overweight. And you could be completely healthy otherwise, with just a body mass index of 40. Or someone has a body mass index greater than 35, which is around 70 pounds overweight, with medical problems. When I say with medical problems, the most common ones insurance companies are looking for: diabetes, high blood pressure, and sleep apnea. Now, from my perspective, though, anyone who has health and lifestyle problems related to their weight is potentially a candidate to undergo surgery, as long as they've tried all these other medical things, medical treatment plans, and have failed. If it just isn't working, it's time to switch gears and try something else. And the surgery then could potentially just be but really shouldn't be the last answer either. So what are the options then? We talk about having surgery for weight loss. You'll hear a number of terms out there. And weight loss surgery is sometimes referred to as bariatric surgery. Baros comes from the Greek word baros means weight. Okay? So bariatric surgery is weight surgery. So common surgical options then: gastric bypass, which has been around since 1955. It's been around for a long period of time, so it's a very well studied operation. Adjustable gastric bands. They've been around worldwide since 1993, in the U.S. since 2001. And sleeve gastrectomy is what I'll call the newcomer to the field. It's been used as a weight loss operation now over the last 10 years. And the main reason it came about is because about 13 years ago, there was a hormone called ghrelin that was discovered. And ghrelin is a hormone made by part of your stomach, and it makes you feel hungry. And we find, hey, if we remove this part of the stomach, we've actually done two things. We've actually made your smaller stomach so you can't eat very much, but we've also then made that hormone ghrelin go way down. And when ghrelin levels go way down, hunger is much easier to control. And if you think about it, hunger is one of the downfalls of just about every weight loss plan in the world. But anyway, these are the three common options that are out there. The most common ones done worldwide, and literally the most common ones done in the United States. These are the ones that typically, if insurance covers this, that these are the ones they'll cover. Now, gastric bypass, until the last couple of years, was the most common operation done for weight loss. But over the last 2 years now, sleeve gastrectomy has overtaken that, and sleeve gastrectomy is now the most common operation done for weight loss in the United States. It's close to 95% of what I do nowadays. And again, I've done close to 3,000 gastric bypasses. All right. So anyway, very common operations. But let's kind of talk a little bit about each of them, and then talk a little bit about advantages and disadvantages of them. This is a picture of a gastric bypass. And with a gastric bypass, we bypass part of the stomach. We make you a tiny little stomach, and then we bypass the rest of the stomach. I don't think you can see my pointer, so I can't really change that. But that the bigger section is the part of the stomach that's been bypassed. The little tiny stomach, which is about the 11 o'clock position, if you're thinking it as a clock face, that's the little tiny stomach that we make you. But we make you a tiny little stomach, and then we bypass the rest of the stomach. But that also means we change your anatomy. So we refer to gastric bypasses as being restrictive and malabsorptive. Restrictive means we're making you a smaller stomach. And it's a very simple concept there. Make you a smaller stomach, you can't eat very much. But then it's also malabsorptive. And the malabsorption comes in because we bypass part of the stomach and a very short portion of the small intestine. So by doing that, then you don't absorb things perfectly. So you don't absorb all the calories that you eat either. But potentially problematic is that you don't absorb some of the vitamins, micronutrients, minerals as well. And so subsequently, this can be problematic from a nutritional standpoint long term. Very long experience in the U.S. Again, the first gastric bypass done in 1955, so it's been around for a long period of time. Surgery doesn't take that long, and most surgeries nowadays, they can be done laparoscopically, which means minimally invasive. We make little tiny incisions on you, and subsequently then we can do surgery. So recovery is pretty quick, But this is still a big operation. We start changing your anatomy around, so full recovery is a good 4 to 6 weeks. Adjustable bands, just kind of go over what that is. It's a picture. On the right side, that's a picture of a band on the stomach, and the picture on the left side just shows the band filled and emptied. Okay, the adjustable part of the whole thing. But the concept here is pretty straightforward. We're placing a band around the top of the stomach that makes you a little tiny stomach just sitting above that band on the right there, and then the rest of the stomach sitting below the band. And then we can adjust it. So a little tiny stomach, so you eat a little bit of food, you get full, and then we can adjust that. We can slow down the emptying of that little stomach. And that's what that picture on the left then is showing, the band open, kind of opened and closed. And the way we can adjust it is because there's some tubing that goes to a little port. The port we place under your skin on the abdominal wall, so on the under the skin of your abdomen, and subsequently then we can access that little port with a needle. And by doing that, then we can either tighten the band or loosen the band, so we can adjust the thing. And so that's kind of, and you do need to have this adjusted throughout your lifetime, but then we can control that somewhat. But your anatomy is still normal, and we don't divide anything. So we often refer to as adjustable gastric bands as being the least invasive approach to weight loss, okay, as far as surgical weight loss goes, because we're not stapling, we're not cutting, we're not rerouting the intestinal tract. It is adjustable and reversible. Reversible meaning that if we needed to get you back to normal, we'd have to go back in there, so it would be another surgery, but we basically cut the band, slide it out, you're back to normal anatomy. And then it is also adjustable. So what I tell people, the good news about this operation is that it's adjustable. We can tighten this thing down or loosen it. We can adjust as we need to. Now, the bad news about this operation, though, is it's adjustable, meaning that we have to adjust it. It doesn't work worth beans at all if you don't get it adjusted, and you have to get it adjusted throughout your lifetime. Okay? And so usually during the first year you need about 4 to 6 adjustments. Long term it's about once a year. So it's not like it has to get adjusted all the time, but it is something you have to do it, and that's a forever thing. So it's a very low malnutrition risk because your anatomy is normal, so you absorb things normally. The surgery itself doesn't take very long. It takes about 40 minutes. Most are done about as an outpatient. Recovery is very quick with this. When we're not dividing the intestine, you recover very quickly with this. Generally, you're back to pretty much normal activity in 2 weeks. Sleeve gastrectomy, again, the newer kid on the block, and what we do here is remove what's called the greater curve of the stomach, and it makes you a tubular stomach. What I want to point out, and it's, hopefully you can imagine what I'm telling you, is that part of the stomach that's there, kind of on that picture on the left side, is the stomach and the intestinal tract. The stomach is kind of that upper area that's kind of widened out there, and you'll see that some of it is separated from the from the side of it. It leaves you with a tubular stomach. The part that is a slightly different color, a little bit lighter, that part's actually removed. So even though it's shown in the picture, that wouldn't be there at the end of your operation. And it's that part that also makes that hormone ghrelin that I mentioned earlier. So we change the shape of your stomach. Basically, a normal-sized stomach can hold about 2 to 3 liters. So if you think of that 2-liter Coke you get at the grocery store, that's a relatively small, normal-sized stomach. Okay? So we take that and we make it basically about the size and shape of a medium banana, and so much smaller. But when we remove that other part of the stomach, the hormone ghrelin goes way down, and when ghrelin levels go way down, hunger is much easier to control. But because your anatomy is still normal, meaning food still goes through normally, it's just a smaller stomach, but food goes through normal, don't have that potential nutritional consequences that we see with gastric bypasses, but we also see very good weight loss with it. And again, probably it's the most frequent operation done nowadays in the United States. So it's the fastest growing option in about 95% of what I do. Surgery itself doesn't take very long. It takes about 45 minutes, and 95% of them now we actually do as outpatients. People come in, have the surgery done, going to spend the day at the hospital, typically go home at the end of the day. Full recovery, not quite as fast as those adjustable bands, but is a lot faster than gastric bypasses. Typically at 2 weeks, you're going to feel like you can pretty much do whatever you want to. At about 3 weeks, you can do anything you want to. All right, now let's back up a little bit and kind of talk about advantages, disadvantages. Advantages with a gastric bypass is that you see very good weight loss with it. And literally we see about 70% of what you are overweight. So what does that mean? Well, if you're 100 pounds overweight and lose 70 pounds, there's 70%. Okay, so when we talk about excess body weight lost. And so 100 pounds overweight, losing 70% is about 70 pounds. Now that's average. Some people lose more, some people lose less. So very good weight loss with that. Disadvantages are, well, okay, you've got abnormal anatomy. And because of that, you potentially don't absorb things perfectly, which is part of how the operation works. But potentially there can be some vitamin and nutrient deficiencies long term. So we do have to check on these things intermittently forever. And you may have to be on extra, different things. It might be on iron, B vitamins, calcium, vitamin D. There's a number of things that need to get checked intermittently because they potentially can get a little out of whack. So those potential nutritional problems are forever. Again, with abnormal anatomy, potentially that can cause some problems too. Just you're going to have more scar tissue. Abnormal anatomy can potentially get obstructed, and so there are a number of little things that long-term can occur. It's a bigger operation, so at the time of surgery, the actual risk is a little bit higher, and there's a little bit longer recovery. We talk about risk with surgery. The biggest things we fear are infections, and kind of the biggest infection we fear is something on the inside. And those, we'll talk about leaks from the intestine when we start dividing your intestine. The risk of that with any operation where we divide the intestine is about 1%. So it's still fairly low, but again, not impossible there for those things to happen. It's a bigger operation, so that's kind of the disadvantage there. Adjustable gastric bands, well, there's no stapling, so your recovery is very quick. So there's no stapling, no cutting, no intestinal rerouting. It's adjustable, reversible. There's very low malnutrition risk because you absorb things normally. Very quick recovery. Now, the disadvantages with the adjustable gastric band is the weight loss is much slower. And on average, there's a much poorer weight loss. The average weight loss with adjustable gastric bands is about 45% of what you are overweight. So if you're 100 pounds overweight, that's 45 pounds. And this does require adjustments in checking on this device forever. And so long term, that has to get checked on intermittently. And then the device itself could potentially cause problems. And that's where I see over the last 12 or so years of doing adjustable gastric bands is that we're seeing more and more problems with the actual device as time goes on. So at this point in my career, I'm not a huge fan of adjustable gastric bands, not because they can't work and not because it's not a safe surgery, but because the device becomes problematic long term and we're seeing more and more problems with devices. Sleeve gastrectomy, the advantages here is also the average weight loss we see is about 70%, which is basically the same that you see with gastric bypasses, which inherently when I started doing sleeve gastrectomies didn't make sense because, why should I see very similar weight loss to a gastric bypass when we're talking about a banana-sized stomach versus an egg-sized stomach and nothing is bypassed? Why should we see that same weight loss? Well, I think the real answer there is because the hormone ghrelin goes down. Ghrelin makes you feel hungry. If we can control hunger, it's easier to stick with the plan, so to speak. So advantage is very good weight loss. We see very quick recovery. Again, most of them we do is outpatient. You still have normal anatomy. Food goes through normally. Nothing is bypassed, so you don't have the malabsorption. We also, again, see hunger better controlled. And from just an economic standpoint, people are often nowadays, many times insurance doesn't cover weight loss surgery. Just from an economic standpoint, this can be done very economically, and we have probably some of the best self-pay prices in the U.S. probably, and it's less than $14,000, which is basically kind of half the price of a mid-sized car if you're buying it, and this will last you forever. Okay? The disadvantages here from a sleeve gastrectomy are very minimal, and the disadvantages I throw out there is I can't put it back in. Once I've taken that part of the stomach out, it's out, so there's no way you can actually reverse this operation. Now, for the life of me, I can't figure out a reason why you'd need it or want it to get reversed. But if you did, I couldn't do it. Okay? So it is non-reversible, but still your anatomy stays normal. It's just a much smaller stomach there. So in summary then, weight loss surgery can be an extremely important part of an overall health plan. Certainly a weight loss plan, but an overall health plan improve all those medical problems that we mentioned. Because pretty much everyone that I mentioned or had on that slide at the beginning gets better with weight loss. It's amazing to me how many medical problems are directly related to weight. We control weight, we give you the best chance of living that long, healthy life. Just from looking at all comers, people that are interested in surgery, I think for most people, a sleeve gastrectomy is probably a better option. And part of the reason is I've been doing this long enough, over the past 21 years, and I see people that have had bypasses, one, that don't do so well long term because either from a nutritional aspect, but also we do see significant weight regain over a long term with some gastric bypasses. When you look at some of the studies out there, it can be up to 30% of people are regaining pretty much all their weight back. So I think for most people, a sleeve gastrectomy is probably a better option. And a third part there, as I put in this summary, is don't count it out. Don't count out weight loss surgery just because you don't have insurance coverage, because we can actually do some creative financing, and financing options are available to make this something that can be potentially very worthwhile for you to do. If you think about, we can add 5 to 10 years of someone's life with weight loss surgery. What is that really worth? I mean, potentially that's, I don't know if you really can't put a number on that, but and especially not just 5 or 10 years of life, but actually being able to be able to do the things you want to do, things we really can't put our finger on, such as, all the, I often talk to people about, the benefits of weight loss surgery. Yes, we can see the pounds come off, we can see your cholesterol get better, we can see your diabetes get better, blood sugars come down, blood pressure come down. All these things we can measure. All these things that are measured, and they're very, very important. But the things that you can't measure, such as, can I do the things I want to do? Can I get down? Can I go shopping and enjoy myself? I don't know. Can I climb the stairs without being in pain? Can I get on the floor with my kids or grandkids and play with them? Can I do all the things I want to do in life? Can you do those things? And that's what really life is all about. It's not about a certain pound or a certain health problem. So it's these things that we really don't measure. And those are the things that really can be the greatest benefit to anyone that's having weight loss surgery, and getting their weight under control, getting their health under control, but literally it's sometimes just getting your life under control too. All right, so I did a quick I'll say a quick overview of weight loss surgery there. I didn't get into some of the risks with surgery. I'd be happy to talk about it if people have specific questions, but I do get into that a little more when people come in and we do that full seminar, because knowing the risk of any type of treatment is important. As time goes on now with technology, though, the risk of having weight loss surgery goes down further and further, and we see surgery, even major surgeries, can be done very safely on people, and so a lot of those risks are I'm not going to say in the past or not, but we've seen less and less problems with people as time goes on. So, questions out there, Amber, I'll throw it back to you if there are questions on there. Again, I threw out the slide up here. There's our contact information again that I'll leave up there. Amber, what do you got?
We have had a couple questions come in. Dr. Clark, first off, that was really interesting and very valuable information. I really enjoyed that. So we had a couple questions come in, and I think that we'll be able to get to 3 or 4 of these, I think, before we're going to end for the day. Let them please do so in the chat box to the right. And the first question that we've had come in is, should weight loss surgery be my last resort?
The short answer is no. Okay, it necessarily shouldn't be your first resort either, but sometimes people think of weight loss surgery as the last resort, and it's they let themselves go until nothing's working, and their health becomes deteriorated so much that sometimes that's hard to reverse. It shouldn't be thought of as a last resort. It should be something that's just another option if medical weight loss isn't working for you, then hey, let's start shifting gears, because like I said, we can do weight loss surgery now very safely, and recovery is very quick, and people get back and we see really good weight loss with it.
Okay, all right. The next question, and this is a really good question, how much will my diet have to change after surgery?
Right, okay. Well, it will change, not just as a broad overview. With all these surgeries, typically after surgery you'd be on liquids only for a couple of weeks. Okay, then we get you on mushed up food. You're on that for a couple of weeks, and then very slowly transition onto real food. But it is real food. Now, with all of these operations, you can eat most anything. Okay, with gastric bypass, there's something referred to as dumping, that if you eat high sugar, high fat, you can get into some kind of, I'll call some things that aren't very comfortable for you. But with the other ones, you can eat basically anything you want to. Now, that doesn't mean you should eat anything you want to. So the good news is you can eat just about anything you want to. The bad news is, because you can only eat a small amount, is you've got to make good choices. And that's one of the things we really work on here, is the educational side and the support side after surgery. Surgery itself, again, is a tool. If you think about it, it only takes an hour out of your life, okay, and now we've got that tool for the rest of your life. And getting the most out of it, optimizing weight loss is very important. So a huge part of what we do here at the Center for Weight Loss Success is really the education and support side. We have a full year program afterwards to kind of get you plugged in of how do you do these things. Because the concepts of what to do, I can teach you what you need to do, tell you what you need to do literally in probably less than an hour. The issue there is, how do you make those things happen in life? Because that's the hard part, is making all these things happen in life. But to get back to that original question, will I have to change my diet? Well, very likely you will, but I'm going to simplify it for you. Long term, it's going to be no different than I would recommend really from your medical weight loss side of this. So the diet, I'm going to make this an oversimplification, but the core of your diet long term is going to be three things. One, hydration. Water's the best thing to drink. Number two, good protein sources, which from food, the best ones are meat, seafood, cheese, and egg. And then finally, the broad category of what I'll call colorful vegetables and salad stuff. That's the core of your eating plan right there. That's not really different than the discussion I would be having with you if you weren't contemplating surgery. So yes, that was an oversimplification, but you're going to be eating normal foods, healthy foods, very small amounts.
Okay. Well, that actually, the next question I had come in is the support, and I think you sort of answered that by explaining that you have a full year program. We've had a couple more come in. I think that we're only going to do this one because we wanted to close right at 2:30. But the last one that we have here, and for anybody that did submit a question, we will absolutely get back to you individually about your question. So this question is, I heard surgery is expensive. Will my insurance cover it, and what if they don't cover it?
Right.
I know you said something about creative financing before.
Right. Yeah, well, I guess the bottom line is the surgery is potentially can be expensive. Now, for most places, we've looked into there are a lot of places that charge $25,000, $30,000 to have a sleeve gastrectomy. I'm going to say that because that's the one we're most commonly doing, most common operation now. But we've actually got that down to kind of less than $14,000. There are some creative options there. I know that sounds like a large number, and I don't deny that it's not. But if you think about it, it can change, something that can change your life and literally get rid of so many different medical problems. You're going to decrease lots of other type of issues, from medications that you're taking to how many times you have to go to the doctor to whether you're, how much food you're actually buying. There are lots of little things you'll save money on with that, and potentially, though, this is something that is very doable. It's literally, half the price of a mid-sized car, which a car will last 5 to 6 years, and you're getting another one, whereas this literally is a lifetime. And if putting this in, you think about that as how can you extend your life and a better life. So subsequently, this can be a great option, which in the long run actually can be significantly economical for anyone.
Do you mind if we ask one question?
Oh,
I've
I'm
had
great.
okay, good. I've had multiple ones come in about risks, and
Right.
I had someone ask about fatalities, which is, I mean, a completely reasonable thing to ask when when you're asking about surgery. So, can you
Right.
address
Certainly.
sort of risks and issues with that?
Yeah, the risk with surgery, it doesn't matter what. But whether we're taking a mole off your arm versus big operations on your belly, there's risk involved. And so yes, there is risk involved. And when we think about risk, we can divide it into really two broad categories. And the first is right around surgery, which by medical definition means first 30 days. And the other risks really are long-term risks. Okay, well, most people are really kind of more concerned about that, true first 30 days type of things. And the biggest thing, obviously, is can someone die? Okay, well, we're doing big operations here, and someone's having a general anesthetic. You do have to go to sleep with these surgeries. So the risk of death related to having weight loss surgery now has been driven down further and further and further. And literally, when you look at the statistics, it's about 0.3%. So somewhere, what is that, 3 in 1,000? Okay, so kind of 1 to 2, 3 in 1,000, somewhere in there. So the bottom line is not impossible, but actually that risk is actually about the same as having your gallbladder out, about the same as having your appendix out. And so we're talking about, yes, when we start dividing and working on your intestinal tract, that risk is there, not impossible, but it actually is it's pretty low risk, much lower than having your hip replaced, your knee replaced, having your heart operated on. It's just that typically, you're not choosing to do that. And people do choose to do, I'm not going to say it's an elective operation, but people do choose to have weight loss surgery. And sometimes with heart problems, hip problems, knee problems, you may not be choosing to do that. You kind of need to get that done. So the bottom line is it's actually safer than many of these other surgeries. Okay, then it's like, okay, if you don't die, then what? Okay, what are the other things that could happen? The bad things. So everything else is, okay, you may have a problem, but you're going to get better. Again, the biggest things we worry about are infections. Some infections easy to treat. Urinary tract infections, a couple of days antibiotics, they go away, and those are really rare too. But what about pneumonia? After any operation you have on your belly. So you may have to be on antibiotics for a few extra days, be in the hospital a couple extra days, but typically pneumonias get better very quickly. Again, the most worrisome type of infection after this type of surgery is getting an infection on the inside of your abdomen, where we did your surgery, specifically, and especially with when we start dividing the intestine, could you get a leak from the intestine? And again, the risk of getting a leak, when you look at the literature, is it's less than 1%. What we said, I'm going to hopefully not jinx myself, but in the last 900 or so that we've done, we've had one. So, okay, it's very low, but not impossible. But those are kind of what I'll call the biggest risks. We certainly, anytime you have a general anesthetic, people worry about blood clots. That's pulmonary embolus or a deep venous thrombosis, if people are familiar with that term, but those are blood clots. And anytime you have a general anesthetic, that could happen, and that's why we get you moving up very, very quickly. The best way to prevent any blood clots is getting you moving, because that's where they come from, is not moving. So anyway, go ahead.
Sorry, I was going to stop you right there because we've gone a little bit over. I did want to mention, thank you for being so candid with that last question and very thorough. I think that's great. And for everyone who's listening right now, any other questions that you have, please do contact us. The Center for Weight Loss Success deals with surgical and non-surgical weight loss solutions for you. And we'll be holding more webinars in the future, so please keep an eye out for those. Again, we'll have our winners contacted for the SoulFest tickets, as well as for the books that we're giving out to 10 lucky winners. And please make sure you contact us, and we hope to hear from you soon. Dr. Clark, thank you so much. This was really great and very informative.
Oh, you're welcome. I enjoyed it.
Okay, thank you, everybody. Have a great day.